Dr. G here with naturalfoodsdiet.org. According to the latest CDC statistics, there's 26 million Americans that have been diagnosed with diabetes. Over the past 20 years, there's been a tremendous surge in this disease. And because half of all diabetics haven't been diagnosed, there's really over 30 million diabetics. And listen to this, there are 80 million more that have prediabetes. So in other words, we are getting close to having a half of our population struggling with this disease. Now the other day my son came to me. He's starting out in college and he's asking my advice as to what field of study he should get into. And he was especially asking in light of our struggling economy and the massive national debt our nation has. You see, the doom and gloom of living in a country that potentially is going to go bankrupt has many college kids wondering what industries will survive. This is especially poignant when they look at today's graduates working at McDonald's or not finding a job at all. Well, as I told my son, in every crisis, there's an opportunity. So listen up, all you high school seniors out there. Based on the diabetes growth numbers, one of the most in-demand jobs would be a medical specialist that treats diabetes. And that's an endocrinologist. It's the endocrinologist that tries to reduce the bad outcomes with drugs and insulin for diabetic patients. Now there's already a severe shortage of these specialists, and this shortage will just get worse as our diabetes epidemic intensifies. The diabetes explosion is truly a national tragedy. Diabetes is the leading cause of blindness, amputation, and kidney failure requiring dialysis. It's also a major contributor to stroke and heart attack risk. These are two big maimers and killers of people in our society. Now the paradoxical thing is that diabetes is easy to prevent. Some simple measures are avoid excessive sugar and refined carbohydrates, avoid processed oils, reduce toxin exposures, and practice regular detoxification. Have an exercise program, reduce stress, get adequate sleep and rest, and most importantly, eat a natural, ancestral diet tailored to your individual metabolism. Now the alternative is to follow our culture and go with the flow. And if you do that, I'll visit you in the waiting room of my son's endocrinology practice. This is Dr. G. Thanks for watching.